He is actually competing in the Invictus Games, which is for a retired serviceman, and he has overcome all the difficulties and he won 4 medals at these games. So being a cancer survivor is really a little bit like this. So much has been taken out of you, but at the same time you have soldiered on with your treatment, and the treatment is now over. But many times a lot of people forget about your years in the process of the NPC treatment. Now, I'm very passionate about ears because I have a special training in ears and hearing. So, hearing affects a lot of our life. It most importantly affects hearing, and as a result, affects communication with our loved ones and with our colleagues, as well as when you go out simply to buy food at a hawker center, you're actually trying to communicate via hearing and speaking with the hawker. Also, ear issues can give you problems such as damp ears or tinnitus, which can affect your quality of life as well. Of course, those of us who know how to drive, hearing is also one of the important senses we need to be able to maintain our driving license, so it affects your ability to drive. Now, hearing also can affect mental health because hearing loss makes people become depressed. They feel anxious to go out, and end up becoming socially isolated. And that is also not very good for mental health in general. And last of all, I will also touch on how hearing loss is linked to dementia and the evolving evidence for it. Now, the ear issues one faces really depends on which part of the ear is affected. It can be external ear, the middle ear, or the inner ear. In the external ear, which is the portion from the outer ear all the way to the eardrum, you can have the following problems. Number one, earwax, which is very common. Even in patients who have not undergone radiation, earwax is a very common problem as well. Number one cause of earwax is actually digging with any instrument, be it a metal spatula or a Q-tip, because many a times it disrupts the whole migratory pattern of earwax, and as a result, the hairs in your ear canal cannot sweep out the wax anymore, so it becomes very heavy. It weighs down on the hairs, and starts to accumulate because earwax is really a desquamation process from your eardrum all the way up. So it starts to accumulate and becomes impacted. Now, apart from earwax, there can also be ear infections. The ear skin overlying our bone in the ear canal is very, very thin. So any small nick through either a Q-tip or even your fingernail can actually break the skin. And then in hot and humid Singapore, where there's a lot of humidity and moisture, and our ear canal skin sweats, it tends to become very moist. It attracts bacteria to join, and it becomes infected. The other thing is NPC survivors, the ear canal skin is very thin, which makes it also more prone to becoming dry. It can be very itchy. People also like to dig because of the itchiness, and it breaks the skin and it starts this vicious cycle of infections. For some of the older NPC survivors, who underwent the old style radiotherapy, where there was a very strong radiation dose without much shielding of the ear canal, the bone starts to melt away and become brittle as the years go on. So at about the 10-year mark, some patients actually have what we call osteoradionecrosis of the ear canal, where the bone becomes honeycombed instead of becoming a strong piece. It starts to break away at different parts, and so the honeycombing breaks apart. The bone becomes honeycomb light, so the skin first of all becomes broken. It becomes very angry. This is a picture. It becomes very angry. It bleeds, and then also at the same time, the underlying bone is pothole, and so can become neither for collecting moisture or infection. So this is called osteoradionecrosis. It has two problems. It gives people pain, bleeding, as well as infection. In some cases, if the radiotherapy was done a long time ago and the osteoradionecrosis keeps being very weepy and bleeding after many years, we must be worried about whether there's a secondary cancer within this as well. But fortunately for NPC survivors nowadays, this is getting less and less common because we have better modalities which target the nasopharynx more specifically, and tries to reduce the risk of these kind of side effects of the radiation. Also, there's canal stenosis. For some patients, over time, instead of their bone becoming brittle, it becomes the other way around, becomes very thick, so it becomes more heaped up bone, and becomes the canal becomes narrow, giving canal stenosis. This gives you a different problem, doesn't give you infection and bleeding, but rather it gives you accumulation of the ear wax, or it can give trap moisture when you say you go swimming, and it can give you a wet ear. All right, so here we go, canal stenosis. Now, the next part we want to discuss is about issues behind the eardrum, which is known as the middle ear. Now, if you can see, the middle ear is actually connected to the back of your nose, called the eustachian tube. And this is what I mean. This is a picture showing the back of your nose. So all of you have, I'm sure, undergone scopes. Uh, for diagnosis and surveillance, and this is the right eustachian tube. So if you go through this tunnel, it actually goes all the way into the middle ear. Now, just think about it when you have a tumor, which is the NPC, which blocks the eustachian tube. It prevents a proper ventilation of the middle ear, and as a result, a lot of the fluid gets backed up inside, and that some of you might have gone to see the doctor because I have a blocked ear because of the obstruction from the tumor. Now, after treatment, the tumor melts away. But what the radiation does to the eustachian tube is actually it causes fibrosis of the eustachian tube, resulting in a narrower eustachian tube. So the problem post-treatment is not an obstructive problem anymore because the nasopharyngeal tumor has melted, but rather the eustachian tube now faces its problem of it cannot open and close or react as well or as fast as it used to be. And so that results in a lot of middle ear fluid. So here you go, you have a picture of what we call a middle ear effusion, which is basically clean sterile fluid within the middle ear space. And the reason why many NPC survivors still have this problem is basically because the eustachian tube cannot expel, or rather relax, so that the fluid can be expelled in time. So over time you get this block ear sensation, and like Dave had mentioned earlier, he gets echoey feeling because of the fluid accumulation, and also there's now the bone conduction of the sound is also abnormal from this fibrosis and the thickening or thinning of the surrounding bone around the ear due to, say, osteoradionecrosis or fibrosis. So in some patients, because the fluid in there is too much, or just imagine if you go and take an aeroplane with so much fluid, the pressure during the aeroplane flight can be so much, and the fluid has to go somewhere. So where does it go? It pops out through the eardrum, so it becomes a perforated tympanic membrane. Now, in normal non-radiated patients, most of the time it heals. 99% of the time, it heals by itself spontaneously. But in NPC survivors, healing is not as optimal as before, and it can either be very slow, or in some patients, the worst case, the hole remains. That means it doesn't heal. What it means for this patient is that instead of the fluid being stuck in an enclosed space, that means you just get blocked. But the ear is dry. Instead, the fluid keeps coming out the ear canal, which then means that you have a wet and damp canal. You get a damp feeling in your ear, which is not very nice feeling. And also, it can then, of course, introduce infection in any damp or moist areas. Patients who have what they call middle ear effusions also have conductive hearing loss. That means there is a problem with the sound transmission from the eardrum all the way to the nerve because of this fluid. So what can we do for middle ear effusions? Number one, if it's very mild, doesn't bother you, just leave it alone. Because if it's just a dry ear, you just feel a bit echoey sound, but you can still hear people talk, just leave it alone. Now, to get rid of the fluid, some patients may get grommet tubes inserted into their middle ears, but grommet tubes don't stay there forever. They obviously will come out with time because that's the natural progression of grommet tubes. As your ear skin is being renewed, the grommet tubes also come out together with the ear skin. So they at most last 6 months. Sometimes maximum it may last about stay there about a year. Grommet tubes basically sit at your eardrum and allow the fluid to come out. Um, Oh, sorry, this is a typo error. So grommet tubes may require repeated insertion depending on the patient condition and whether they feel uncomfortable with the blocked ear or not. Grommet tubes require a water precaution. So when you go swimming, you need to be careful. Certain water bodies are not advisable for patients with grommet tubes. So swimming pool water where it's chlorinated is okay, but no river water, ocean water, those are not non-chlorinated water. It is a possible route for infection. Now, there is also some talk recently in the medical literature about why don't we just dilate your eustachian tube because it's narrow and tight, right? Why don't we just put in a balloon, like a heart balloon, and make it dilate it open, blow the balloon up, and then cause it to the eustachian tube to widen, and then maybe might work. There have been many trials since in the past few years, and the results have inevitably been short term. So, which means that patients post eustachian tube dilatation feel their best improvement within 6 months. After 6 months, the benefit seems to drop, and by 24 months, actually the fluid reaccumulates, and then the conductive hearing loss recurs again. But nevertheless, they had a good 24 months of being able to hear a bit more clearly and less irritation from the blocked ear sensation. But the caveat is actually eustachian tube balloon really depends on how much distance there is between your tube and your there's a carotid artery. So a lot of it is you need to do a CT scan beforehand, make sure that its clearance is safe before we do such a procedure. Now, some patients do may require repeated dilatations if they feel that, I like the effect within 24 months, but since it's come back again, can I do it one more time? So there's an avenue for that. The good thing about eustachian tube dilatation is that you don't need water precautions. You can swim in anything you want. You don't need to take special precautions during shower time, and there is no feeling of sensation of wet ear if should you have any flu, or if a little bit of the fluid from the middle ear comes out. All right, so last we want to talk about inner ear problems, which is very prevalent issue in NPC survivors. And the inner ear problems experienced are sensory neural hearing loss as well as tinnitus, because they are kind of go hand in hand. Let me delve a bit deeper into it. So sensory neural hearing loss is basically the inner ear, is as well as the nerve start to lose some hearing, and the reason why this happens I will show you later, but here are the statistics. So sensory neural hearing loss is a very important adverse effect of NPC treatment. The incidences of the sensory neural hearing loss after IMRT, which is the targeted therapy, no longer the big blast of like 30 years ago, is 37 to 51% at high frequency. So high frequencies are more affected compared to the lower frequencies. Now, to understand what's the difference between high frequencies and low frequencies, I put it in terms of speech. So if your low frequency hearing is affected, you can't hear speech as clearly. So speech intelligibility. So you can't even hear anyone talk. But high frequency is needed for speech discrimination. So someone with high frequency hearing loss can hear a speech being taught, but the words may not be clear. Certain words like TH sounds, F sounds, S sounds, very high frequency sounds may not be as clear as before. They may sound a bit more flat. What this means for patients long term who cannot hear high frequency sounds, is that they gradually also start to be not so clear in their high frequency consonants as well. So THS sounds, because they have lost their ability to discriminate that. But nevertheless, the percentages are low. As you can tell, low frequency 22%, high frequency loss about 51%. And when does this occur? It usually can occur immediately during treatment time, or at least about 18 to 24 months after. But once that stage occurs, as in once your hearing loss, should you get it, occurs at 24 months, most of the time it does not deteriorate any further. But of course, as age goes on, if you live to 90 years old, there's some old age loss added onto it. Now, why do NPC patients tend to get sensory neural hearing loss? This is a picture of what we call radiotherapy mapping. So radiotherapy mapping, we nowadays try to avoid the cochlea and the inner ear because we don't want damage to the inner ear, which will affect hearing. But nevertheless, there is some degree of radiation damage to the what we call the basal turn of the cochlea, which is somehow more sensitive to radiation change. The other thing is cisplatin, which is a common chemotherapy agent added for stage 3 and stage 4A NPC. Is a very good radiation sensitizer. That means it really helps the radiotherapy kill the tumor cells. But at the same time, it's also very quite ototoxic. It acts synergistically with the radiotherapy to increase the risk of damage to the hair cells. It's a good killer, let's put it this way. But it doesn't discriminate whether it's good cells or bad cells. It kind of causes hearing damage as well. So some of the risk factors for sensory neural hearing loss in NPC patients would be, of course, the higher your inner ear or cochlear radiation dose, obviously naturally you would expect a bit more sensory neural hearing loss. Also, cumulative cisplatin dose. The papers now say that the optimal dosage is actually more than 200 milligrams per meter square. And of course, some papers have noted that if you have post-op radiotherapy middle ear effusion, that means after the tumor in the nasopharynx is melted away, but your middle ear still has the effusion, then you are probably more prone to sensory neural hearing loss as well. We don't know the mechanism. That is just something they had noted on their studies. Now, some of you might have read in the papers that nowadays there's a proton beam radiotherapy, and it's been touted to say that it's got less side effects, and it's also it's used quite commonly for what we call cranial CNS tumors, nervous system tumors. But between photon therapy and radiotherapy, if we actually look at the data and extrapolate, the ototoxicity is still the same between proton and normal radiotherapy. So what can I do for my ears? Now you ask me. Number one, I would suggest please don't dig your ears, because instrumenting your ears would disrupt the natural flora and fauna of your ears. The other thing is, if you have any ear infections, treat it early. If you have no time to go back to your NPC doctor, go and see a GP, or just make an appointment to the normal ENT clinic is also a good idea, because we want to stop the infections when they are early, rather than when they have gotten a bit more fulminant. The other thing is, if you are into water sports, it would be good to have customized ear plugs, especially for the NPC survivors who have had more than 10 years, because I'm sure 10 years of radiation ago, because your ear canal would have changed, and the normal foam ear plugs may not fit your ear canal shape. In fact, some of it may also be a bit abrasive to the thin skin you have in your ear canal. So please consider some customized ear plugs if you are a heavy water sports person. The other thing would be monitor your hearing regularly, because if you start realizing that hearing loss is actually a gradual process. If post-op radiotherapy, it's good to have a baseline hearing to know that, okay, after radiotherapy or concurrent chemo and radiotherapy, this is my baseline. So moving forward, if anything there's a drop, then at least we know that, okay, maybe that we should start taking action like hearing rehab therapy earlier rather than later, so that you can work optimally at work, as well as to hear your family members at home as well. The other thing would be auditory hygiene, and I think this is not an issue for the young people. I think anybody of any age group needs to start to take note of the volume at which you hear your Zoom interviews or your Zoom meetings and webinars now. Anything more than 60% is actually considered a little bit too loud, especially if you're listening for long periods of time. The other thing would also be the duration which you hear music. If you have listening to loud music, if you have to come into contact with loud music for 1 hour continuously, give your ears a 5-minute break to let it recover, so that you will not at least your ears, your nerves and your inner ear get some respite from all the loud sound. Secondly, also, if you have to, nowadays there's a lot of revenge, what we call entertainment. So if you would like to go to the clubs, go and listen to Taylor Swift concert, please try to stay away from the loudspeakers. Don't stay too close. Also, common sense would be, if you try not to go stay if you have to be at the loud clubs, nightclubs for very long, step out for a short while, rest your ears for about 10 minutes, then step back inside. Hearing auditory hygiene is very important, because recreation induced hearing loss can be a problem down the road if you don't take care of your ears today. And this, please share with the younger people in your family as well, because many of them think that, hearing problems will be really long time, more in like 70s or 80s, because they're now in their 20s. But every little bit accumulates and becomes an issue down the road. So if you notice that you cannot hear your family as well as before, or your family keeps saying, "Hey, why is our TV becoming louder and louder?" Or you find that you have to get people to repeat themselves when you talk to them, or someone says, "Hey, you're talking very loud nowadays," maybe that's some signs that you actually need to check your hearing if you have not checked in a long time. Also, some things like environmental sounds, you can't hear things as clearly as before, like the telephone in your house. You may not be able to hear it so clearly, and you might miss it, or doorbell also. That is something to be worried about as well. All right, so in NPC Survivors, our treatment priorities is to first let you know that eustachian tube disorders is here to stay. The radiotherapy may have melted the tumors, but it has also caused some side effects, and that is something which I cannot reverse, and no amount of medicines or therapy can reverse. And in terms of priorities, we try to create a safe ear first. Means safe ear means we make sure that there's nothing like a second tumor in your ear. Secondly, we want it to be dry. So between a ear which is blocked and echoey versus a wet ear, I would rather you have an echoey ear than a ear which keeps discharging because there's infection on board of it. It's very uncomfortable. Many trips to see the doctor and a lot of discomfort. Then lastly would be to try to manage hearing loss, because hearing and communication is such an important part of our life and to keep plugged in with our society. So apart from medicine, sometimes, of course, you might have to experience procedures like cleaning your ear. For patients who had eardrum ruptures, after many frequent infections, you might want to consider patching the eardrum back. It's a very simple surgery to patch the ear hole back using your own fascia skin. The next step to improve hearing would be hearing aids. There are many different models nowadays, from the very tiny ones called invisible in the ear uh, canal, which is the one on the extreme right. That means people don't even know you're wearing a hearing aid because it's stuffed all the way in the canal, to those which are behind the ear canal, and they just sit behind your ear pinner, and a small little transparent tube sits inside the ear, amplifying the sound. Now, just a quick explanation on how hearing aids work. They amplify sounds to an audible level, and the amount of amplification depends on yourself. So you cannot share hearing aids with your mom, your elderly mom, because her hearing loss pattern is different from yours. Also, nowadays, there are additional features such as noise reduction, because if, say, you sit in an MRT, it's very noisy, you want to have noise reduction, it can be done. Feedback cancellation. Remember last time, the patients might complain, hey, very noisy, my hearing aid, all that. That's because the microphone is actually gathering a lot of extra information from the surroundings. So now there's feedback cancellation. A lot of it is also, a lot of hearing aids are now Bluetooth enabled, so you can stream phone calls and music directly into your hearing aids as well. And also there's a lot of extra features like directionality or automation. The performance of your hearing aid really depends on how many channels you have in your hearing aid. And of course, the more channels you have, it becomes more expensive. To understand what this means is that look at this bottom graph of four channels. So four channel, you know that, okay, it amplifies at just these frequencies, four frequencies. And then you hope that it will be able to help you hear better. But as you can see, 15 channels, they are very, very specific in your degree of hearing loss. So which means that, okay, at 4 kilohertz, they will boost out this amount. So it is very specific to you, and as a result, it's not so noisy. It doesn't have that feedback which the older hearing aids used to have, like sound, and the person next to you can hear. Why? Because it actually is very customized now. It's very precise which level and which frequency needs amplification. So as a result, you actually hearing aids nowadays can make you hear much better, and the signal quality is better. Also, wireless connectivity, which I spoke about. Now, so does it work? Many people always ask me, hey, does it work or not? Now, please understand, hearing nerves once weak already, nothing can be done to rescue it, no amount of medicines. But the hearing aids can help you amplify whatever existing sound within an existing spectrum which you may be experiencing to an understandable level, so that you will be able to go out, experience social interaction, and also reduce stress and brain fatigue on your brain, which also links to dementia. All right. Now, hearing aids need some time to acclimatize because it's really about your brain hearing. The hearing aids only transmits the sound to your brain, but your brain needs time to acclimatize the new kind of sound so that it can understand it and listen well again. So hearing aids need some acclimatization, and please be patient with them and your brain as well while acclimatizing. Now, tinnitus is also a common condition I see in the NPC survivors because it's linked to hearing loss. um, Tinnitus, for those who are uninitiated, is like ringing, buzzing, hissing like crickets in my ear, that kind of thing. And that's because of the damage to the inner ear, the cochlea, as well as the hearing nerve. The treatment is largely sound therapy, wearing hearing aids if the hearing loss is quite severe, basically to reduce the amount of hearing burden on your nerve, and so the nerve can calm down and be able to the brain can then concentrate on other things like thinking, planning, rather than concentrating a lot of its effort on trying to hear. So treatment for tinnitus, apart from hearing improvement, would be sound therapy, counseling, and education. Now, tinnitus, the aim for any sound therapy is habituation and relief, which basically means telling your brain, hey, this sound is actually not and it's not an abnormal sound. It is actually part of your nerve trying to hear. So what we try to do in sound therapy is, okay, I've got three things here, but basically the first step is to characterize the kind of sound one is hearing for tinnitus. Everybody's sound is different. It can be high pitched, low pitched. The volume of which one hears it is also different. Somebody may hear it at 30 dB. It's not as irritated as somebody who hears it at 80 decibels. So therefore, the irritation to everybody with tinnitus is different. So on the left here is what we call a sound masker, which basically a tinnitus sound masker. Once we know that characterize the tinnitus the patient is hearing, we then advocate which sounds which help it, and this is a sound masker. There are also apps nowadays on which you can download in your phone, and also some hearing aids can act as a sound masker as well. So this is Zen tones, and I'm gonna play sounds, and it's basically like wind chimes to help patients hear what it's like. I'm trying to play it to see. Can you all hear it? Dave, can you all hear the
No,
sound? You
no,
can't hear
no,
the
can't
sound
hear,
chime.
can't hear.
Oh, okay.
I hear my own breathing only.
Oh, okay. All right.
Just kidding.
It's actually wind chime sounds actually. And it's you can Google it Zen tones, and it uses wind chime sounds calming effect to help people with tinnitus. All right, let's move on a little bit more. Hearing implants are for patients who have outgrown hearing aids, and it's time to cross over to hearing implants. Now, hearing implants can be two types: bone conducting implants and cochlear implants. For those who haven't seen a bone conducting implant, this is what it basically is. Those who have undergone surgery, this is it sticks on with a magnet. And then those who don't want surgery, you wear it like a hairband, like the shocks, what we call the bone conducting earphones. It is exactly the same. It works on the same principle. There we go. So this is shocks. You run, 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 and this is the bone conducting implant for patients to hear better. It is quite cool nowadays. So that's the surgical and the non-surgical portion. And the last is I put a picture of my very own cochlear implant patient who is an NPC survivor. He is elderly. He underwent NPC treatment many, many years ago. And he couldn't hear very well, and he was actually spurred on to try to get better hearing because he needed to be the caregiver for his elderly wife. So hearing aids didn't help him anymore, and at the age of 79, he actually took the step to want to get a cochlear implant to get better. And so this is him undergoing what we call hearing retraining therapy to help to get optimal use of his cochlear implant. And he has a very supportive daughters who bring him for his training. So this is the story of my very own patient, Mr. Tan. But unfortunately, with as age went on, as 80 plus, he passed away, not because of NPC recurrence or anything, but he had a cardiac event. But nevertheless, he was able to use his cochlear implant to help care for his wife and have meaningful conversations and interactions with his family. Now, I would like to share with you all about hearing loss and dementia, and I hope with sharing this with you, you can also share it with the elderly family members you have about hearing loss. Now, if you know, there are actually these things called blue zones in the world. Blue zones are are areas in the world where the people somehow rather have been known to live very long. The 90 years old is considered normal, and then for them, 100 everyone in their village aims to live to 100 years old or more. So Singapore has actually tried to be have they put out a blue plan to say they want to be the next blue zone. And so therefore I want to share with you that it is possible to age well, and obviously Singapore is going to be an aging population in 2030. And a lot of us have thought about retirement planning and how we want to have a good retirement. But have any of y'all come up with a successful aging plan? So, successful aging would also mean a lot of care upfront, preventive care, as well as to understand that successful aging is more than just physical health. You also need to take care of your mental health to age well. All right. So the government knows this, and obviously they have started a campaign. And would you rather be the man on the left, actively having fun playing ukulele with your friends, or would you like to be the man on the right who looks a little bit dejected and alone? So the government has come up with three key themes for successful aging, and I will share with you that care for well-being is the number one. Contribute meaningfully, because obviously we know that social interaction helps, and staying connected with your family and loved ones is important. Now, under care for well-being, the government has laid out active aging, volunteering and learning, and last of all, dementia management. And that is where hearing loss comes in, because hearing loss is linked to dementia. Now, the Lancet, which is a very big journal in medicine, has listed out risk factors for dementia in a lifetime. So, in this diagram, you can see this green circle is about early life. So, things which are protective against dementia will be education. They have found that people with a lower education have a higher risk of dementia. Why? Because they may not be able to read, they may fall into bad company and pick up bad habits like smoking, don't eat well, resulting in obesity. They may drink a lot, because alcohol is known to be a risk factor for dementia and also heart health. Now, if you look at all this, the lifetime risk factors, and there are 21 of them. Hearing loss accounts for the highest percentage of potentially modifiable risk factors. This means that if you do something about hearing loss, you can actually help to reduce your risk of dementia and that of your loved ones as well. Is hearing loss a true problem? Yes. Actually, in 2019, WHO have noted that 430 million people in the world have disabling hearing loss, means they need hearing aids. And by 2050, this number is going up to 700. In Singapore, if you look at this pie chart here, I have drawn, look at the red color, okay? More than 60% of the Singapore population is going to be 60 years old or more. And as you know, in patients more than 60 years old, actually 60% of these elderly have hearing loss. But how many of them actually treat their hearing loss? Only such a small percentage, you know. So actually, we can do a lot more, because dementia, once sets in, is irreversible, cannot change, and is a big burden on the families as well as the as society in general. So there's a lot of evidence linking hearing loss to dementia. It's not Dr. Liu say, hey, got hearing loss, dementia is. It's also based on studies, and the largest sentinel study was done in the United States, where they actually follow up people for 10 years and 670 people. And they found that people who had hearing loss, actually 63% of those with hearing loss developed dementia over time. So this was concurred with other studies with 51%, and actually the risk of dementia is known to increase up to 2 to 3 times more. So Now, then the question you asked me is, how does hearing loss cause dementia? It causes it in three ways. Number one, it causes brain shrinkage. Number two, brain overload and social isolation. Look at this picture. Someone with normal hearing, you can see this is a functional MRI scan. There's a lot of activity going on, and the person with hearing loss, there's a shrinkage of the brain. There's a lot of empty spaces. So that is because hearing loss is linked with brain shrinkage, because after many years of not using your the hearing part of your brain tells itself that no need already, so okay lah, then we just downsize, so it's not stimulated, it starts to shrink. And the shrinkage in hearing loss is compared to patients with advanced Alzheimer's disease. You can see here on the picture on the right, a person with normal hearing, the brain is normal, sorry, normal cognition, the brain is normal. And someone with advanced Alzheimer's disease, that means a lot of the parts of the brain not working already or has gone to sleep. You can see that the brain also has adjusted itself to shrink, and there's a lot of empty spaces. And brain shrinkage, once sets in, cannot be no medicine can actually make it grow again. The other thing, how hearing loss causes dementia, is brain overload. In the diagram number A, think of your brain as a fixed set of cognition. That means by the time you are adult, about 21, your cognition is in place. That means your function is already fixed. It's not going to grow more already. So your brain actually divides it half, 50% into auditory processing. That means trying to hear, and the other 50% into advanced processes like planning, thinking, and working memory. Now, when you have hearing loss, a lot of this auditory processing, a lot of effort is shunted towards trying to hear and trying to make sense of, what's this person trying to say? And as a result, less and less percentage of your brain energy is available for cognitive tasks. Now, this means that as you age, right, you have less and less capacity for your cognition of the higher thinking, and as a result, you have less capacity. Should insults come in, like if you have strokes and all that, less and less of it is available for the higher thinking disorders, and actually, so much energy is channeled towards auditory processing that the imbalance is just too much. So when you actually have hearing loss and you try to treat the hearing loss, you're trying to reverse the balance so that you have more reserves for the higher thinking processes, and that helps in reducing dementia. The other thing, of course, is hearing loss causes dementia. People who have hearing loss scared to go out, don't want to embarrass themselves, they don't want to be a burden on others. So what they do, they stay at home. And stay at home is a very lonely process if you are all by yourself. And even if your family members come for a dinner, and you can't hear, sitting at the dinner table with the rest of them can be a lonely experience because you cannot understand the conversation. So that's why treating hearing loss would be good, so you are plugged in to hearing the conversation, knowing what's happening in their lives, and then also you can also give your opinion as an elder about your life experiences, share with them. So not all hearing loss severities are linked to very bad dementia risk. It really depends on the severity. So patients with mild hearing loss, the dementia risk is two times. So sometimes we just tell you, okay, observe and just hearing hygiene. Some of the patients with mild hearing loss might need hearing aids, like I have put on the picture on the top. Moderate hearing loss, dementia risk is three times. Number one, we will try hearing aids first. And if hearing aids don't work, and you still cannot hear, having difficulties communicating, you might need to consider cochlear implant. For very severe hearing loss, the dementia risk is even higher, five times. I would strongly suggest a cochlear implant on the outset, because it is really the most powerful hearing aid available in medical science right now. And with cochlear implant, once a patient who had never been able to hear speech before can now hear speech very clearly, and can even hear birds chirping, water running, streams running. It is life changing. Now I'm going to put up a few what we call FAQs. Many people have asked me this. I mean, if I have been diagnosed with hearing loss and I don't want to do anything about my hearing loss, just observe. Is there any side effects? Yes, and I think we all need to know that as we grow older and is there's concurrent hearing loss, important information may be miscommunicated. So things like financial information, legal information, writing your will, or even health information may be missed out if your hearing is not tip top. The other thing is that having hearing loss makes you uh, dependent on others, where you may once had been able to be independent and go out yourself. So as a result, you may be highly dependent on your daughter or son bringing you out, or your caregiver. A lot of dependency, which may not be good long term because of mental health and isolation. The other thing is safety risk. Of course, if you can't hear, you go out, you can't hear the traffic on one side, you get into near accidents, then you're like, oh my goodness, I nearly got into a car accident because I didn't hear it. So maybe I should just stay at home instead. It triggers a lot of fear and anxiety. Understandable after near accidents, but it could have been prevented if you were equipped with better hearing. Also, social isolation, like I explained to you, you may be with your family, but you're not really with their communication. If I have hearing loss, does it mean I will definitely get dementia? I think that is commonly asked. The answer is no, because like I showed you, the so many risk factors play a part in dementia onset. But if you are able to mitigate, I mean, help to overturn certain risk factors, every little bit counts towards preventing dementia. And we know now that people with untreated hearing loss have a 42% increased risk of dementia. So apart from having hearing loss, if you can treat it, also go out and interact with people, don't stay at home, mitigate certain things like mental health, it helps towards prevention of dementia. Okay, so does treating hearing loss prevent dementia? And that's an overwhelming yes. All right. Initially, we didn't have studies, intervention studies, about whether treating hearing loss helps prevent dementia. But now we can clearly say, because there's a very good paper which came out in February this year, to show that actually wearing hearing aids in patients who needed them helped to reduce cognitive decline by 19% and also reduce the risk of dementia. So cognitive decline and dementia, a little bit different. Dementia a bit more advanced. Also reduces dementia risk by 17%. So overall, yes, hearing aid use helps to prevent all cause dementia and dementia subtypes and encourages brain resilience. So, in conclusion, I think hearing health and auditory hygiene are very important, not only for you, please share with your family members as well. Hearing loss should also be addressed if because it's linked to dementia. And if in doubt, always seek your ENT doctor's opinion. And with that, I've come to the end of my talk, and I am very happy to take any questions you all would have.
Okay, very good. Thank you, Dr. Liu. First time, Dr. Liu, in our One Heart history of a talk, that you have truly gone beyond just a year. You talk about dementia. Even talk about the government scheme. Really very good. Very
Thank you.
grateful. Thank you so much. Okay, guys. People now. Questions are now. Yeah, throwing out from the floor to Dr. Liu. Please feel free to ask your question.
Mm,
First, I want to address the chat one first. I asked.
mm,
Okay, Dr. Liu. This question says, I'm a survivor of early stage 2 uh, tonsil carcinoma.
mm,
I experienced blocked ear, a sensation like pressure differences, mostly left ear when I exercise with high cardiovascular activities like cycling and running. What causes that, and should I be aware of any damages?
mm. Okay. First of all, you would need to start with at least get a baseline check of your ear. What's it like? Is it clean? Is it got any earwax? Secondly, you will need a hearing test. Hearing test would not only test your nerves, you will also test your pressures in your ear. So that's number one you need to do. Then from the results, we can actually have a firmer idea of what could possibly be the cause. I am not able to tell you what is your cause because I do need a little bit more information. But maybe the first step will be to go back to your ENT doctor, get a hearing test and check. And we can start from there and then try to figure out what's happening.
Okay, another question is, so we should not be digging our ear. Should we be digging our ear when we have feel like earwax is blocking the ear and all this?
Okay, so I think this is very common. You probably dig your ear out of two reasons because it's itchy or it's out of habit. So for itchy ears, the answer is, do you know why your ears are itchy? Because your skin in the ear is dry. So some things help to moisturize it or of course, number one would be olive oil. That's why you have olive oil. Olive oil does a job of moisturizing your ear canal. It also, if you have any ear wax, a little bit, it will help to wash it out as well. Then of course, then you look at certain trigger factors. Is it a new shampoo which made your ear more itchy? Hair dye, that kind of thing, which would have triggered it. Now, the if you dig out of habit, then sorry, I can't help you. You've got to tie your fingers up and don't dig anymore. Yeah, but most importantly, try not to dig, because it disrupts the hair flow. Yeah.
Okay, the third question is ear stroke same as hearing loss due to radiotherapy?
Um, Perhaps the person who put the question for ear stroke, would you like to elaborate? Do you mean a stroke which has affected the artery supplying the ear, or what do you mean by ear stroke? You type in your answer while we take the next question.
Okay,
Is
next question is there side effect of wearing bone conduction earphone like
mm,
shocks, SHOKZ, for
okay.
more than an hour for NPC Survivor?
Uh, there is no side effects of wearing it for a long time. It is. I've tried it myself, and I think all of you should try it. I mean, just go into say Courts or Harvey Norman try. Um, it is fairly comfortable because there's nothing stuck in your ear. It's like really wearing a hairband. And for NPC survivors, no problems. The only thing I would advise you is that the shocks is was actually devised as a running headphone so that people can run and hear traffic at the same time. You understand, right? So they can hear their music but hear traffic at the same time. Therein lies the issue because when you're really running in a place which has loud noise, surround noise, you will tend to on the volume of your music louder and louder to try to overcome the environmental sound. So please be watchful of the volume at which you raise your volume for these Shocks headphones.
Okay, Dr. Liu, next question.
Mm.
Is there possibility to develop eczema in ears canal as I experience unexplained itchiness? What kind
Yeah.
of treatment should I seek?
Yes, it's possible to eczema can arise. It can be atopic dermatitis. That means something has triggered, something new has triggered it, and it is possible to develop it. Yes, agree. Yeah. So the other thing about itchiness, sometimes the itchiness can be due to a underlying what we call low-grade fungal infection. So fungal infections are quite itchy rather than painful. So that is also a possibility. Yep. So get a check of your ears.
Okay, next, applying ear wax via cotton bud.
Mm, what does earwax via cotton bud mean? Do you mean
Apply ear wax via cotton bud. I'm not quite sure the question. Maybe the question is not phrased properly.
okay?
Maybe removing ear wax via cotton bud, is it advisable?
No, not advisable.
Okay. So basically, any self action on removing earwax is not recommended for NPC survivor. Lah.
Yes, yes, correct. You have got it summarized there in a
Yeah, I
nutshell.
remember what you told me.
Yeah. Okay, so I think the gentleman who, I mean the participant who said that about the ear stroke said his uncle had a ear stroke. Um, I'm not sure what ear stroke is, but I'm just hypothetically thinking that anything stroke means there must be a stoppage of the blood flow to the inner ear, and that results in hearing loss. So that would be what we call a sensory neural hearing loss. You would definitely need to do a hearing test, know the levels, and then take it from there. The duration of onset of the ear stroke is also very important because it determines how much can be done within that period of time.
Okay, next question. Why ENT doctor recommend myringotomy as first treatment when there's fluid in the middle ear?
Okay. Myringotomy is different from grommet tubes. Let me explain the difference. Myringotomy just means make a cut in your eardrum, drain out the fluid, then in the next 48 hours, the cut which is made will heal back together. Okay, so there's no tube. Whereas in sometimes in recurrent what we call accumulations, they will put a tiny tube down there so that it can drain out more. So there is a difference. So myringotomy is a is a well-known option to drain out the fluid for patients who really cannot stand the fluid, the block sensation. It gives them some form of relief. Yes. That's Esther's question.
Yeah, okay, Dr. Liu, this is actually a question pertaining to myself.
Mm,
So I got this echoing problem and I can hear my own breathing.
mm.
It's really the eustachian tube is damaged to some extent. I think it's getting worse. So when I try to sing karaoke, also not as effective as last time.
Actually, Dave,
So
I tell you,
yeah.
the answer for your echoing, it's might be due to the fact of your weight loss. Yours, because you have lost so much weight, you may have what we call a patulous eustachian tube,
Oh,
which
okay.
means that if you gain weight and the eustachian tube bulks up, you might you get less and less of this echoey sound. It's weight related.
Oh, okay.
Yes.
So just now you mentioned about the balloon effect.
Mm,
Does
mm.
it help?
No. Uh, Patients like you who have patulous means the tube opening now very wide.
Oh,
There's no
it's the
cushioning.
reverse. Okay.
Correct. You cannot balloon because you make it even wider. Cannot.
Oh yeah, okay, okay.
Can your solution would be try to gain weight, and I think you will slowly see the difference. Can the echo you get
Okay.
less.
Okay. Thank you. All right, folks, any more questions?
I think, hey, hi, Dr. Liu.
Hello.
My name is Sean. Yeah. I have this 0.3 cm lesion on the right vestibule. Actually, I went for MRI, so they say that it's just a normal cyst, just leave it there. And actually, I also did a hearing test, and there is a slight deterioration in the hearing of my right ear. So
Mm,
doctor say just come back once every year to check. And they say leave it there. Because if they go and take out this 0.3 cm cyst, they say that it might damage the nerves and I might lose my hearing. So the thing is, how I came to know of this is once every few months, maybe it can be 6 months or more than 6 months, I have this ear blockage. Lasts for maybe 2 to 4 weeks. After it go off already. Then it comes back
mm,
maybe 6 months or 1 year later. What? Why it goes off, then it come back 6 or 1 month or 1 year later? This ear blockage.
So I am listening from you. You probably have is it a vestibular schwannoma or it's the hearing nerve, right? Hearing a vestibular nerve, correct?
Yeah.
Okay. So the usually the if I'm hearing you right, the tumor is arising from the vestibular nerve, which sits next to the hearing nerve. So depending, our body is quite dynamic. Sometimes it just swells and reduces. So depending on how much is compressing on the neighboring hearing nerve, you can get intermittent good and bad times on your blockage of hearing. Does that understand? Yeah,
Then
but
it will come and go. It will come
sorry.
and go. Then the blockage will come and go.
It may, but ultimately, if you, it's like you plot up and down. The general trend would kind of be stable. But the be good and bad times, good and bad times. That is true. But I think for 0.3 cm is a fair enough plan to actually just monitor yearly, with the small proviso that if your hearing drops significantly during this 1 year waiting and observation period, you better go back and see your doctor faster. That means something must have new must have changed.
Or the way I need to watch out for my hearing on the right side.
The affected
If,
side,
if I
yes,
feel that there is some deterioration,
yes,
I should go back to the ENT. Okay.
yes, correct.
Because
Yeah.
the funny part is after it's gone, like my last, I think my last blockage was in January.
Mm,
So from January until now, there's no blockage.
mm, mm,
Yeah, so it's like the it's quite strange. After 9 months, it doesn't come. And I recall even the one before the blockage I had, the last one was in January this year, but I had one blockage also lasting for 1 month. about 1 year before the one that I had in January. So the one
Mm,
year period I find is very strange. How come it comes 1 year later, after a few weeks it's gone, then 1 year later it comes back?
okay, then may I ask whether your doctor also checked things like the pressures in the ear, the nose? Maybe it could it apart from the nerve, could it be a eustachian tube problem also? Did your doctor check that?
I don't know, he did the hearing test, then
Mm,
did two MRI. I think the first one is the simple one without the
contrast.
contrast. Yeah,
Mm,
the second one is the more that one. Then
mm,
they say that it's 0.3 cm lesion, so
mm,
just leave it there. It's very far away from the brain.
mm,
Then
mm,
ask me just monitor and live with it lah. But
mm.
so far, let's say from January until now, I don't have the blockage anymore.
Okay, that's good news. That's good news. Sit tight, John. Yeah. Thanks for
Okay.
sharing. Thanks for sharing.
Yeah. Okay,
Yeah.
Dr. Liu, next question. I experienced fluid flowing out from my ears and then it just went away. What causes it and what should I do? I thought it was due to water entering my ear during my shower, but then again, sometimes it occurred even without me washing my hair.
So, Augustine, do you have do you know whether your eardrum is intact or you have a broken eardrum? Do you know? Oh, okay. Um, well, the truth of the matter is that if it is two different reasons if you have an intact eardrum and if you have a non-intact eardrum. So let's do the intact eardrum. Your eardrum is intact. Uh, it can sometimes give you a little bit of fluid because of either um it if you wash your hair, actually sometimes some of the water goes in and it actually is a sump effect. It actually sits down there. And then if you move your head, actually the by position, some of it can come out. Other reasons would be there's an underlying maybe some infection, I don't know. And if the eardrum is broken, then very most likely must check the ear to make sure it's not an infection at all. So that is it. The other thing is that I don't know, some of my patients actually experience tell me they have yellow smelly fluid coming from the ear. Then actually we look inside, it's actually wet wax, super wet wax, and which then starts to drip out, and then it gives you this yellow smelly fluid. So sometimes it could be wet wax as well.
Okay, Dr. Liu, next question.
Mm,
I've been wearing my hearing aids for both my ears for about 5 years, and now my left ear,
very itchy.
yeah, very itchy
Okay.
due
Yep.
to wearing the hearing aid. So what can he do?
So it depends on what model of hearing aids are you wearing. Is it the kind where is it the elastic kind where it's the elastic tubing and you can actually change the insert of the tubing to something more comfortable, or is it the permanent hard form, which then you might need to actually your what do you call that, your audiologist might need to shave a little bit to make it a little bit less irritative to your hearing aid, or put some form of a coating over to make it less irritation. The other thing is that maybe you want to ventilate and air your ears. That means intermittently you might want to take it off, and then also make sure that there's no broken skin, the skin is not dry. Clean your hearing aids. I'm sure that your audiologist will teach you how to clean. Make sure there's no green bits, which can be dirt inside. So there are many different reasons for itchy. Then the last thing is also, is there anything new which you have introduced into your routine? Say new hair dye, or that's actually quite common. New facial wash, hair dye, or shampoo or conditioner. Yeah, so have a look and see. Otherwise, if you have a history of eczema, itchy skin yourself, maybe something has triggered it in the recent times.
Yeah, okay. Next one is if the grommet tube is inserted,
Mm.
no hearing on eardrum due to RT treatment for NPC Survivor. We cannot use olive oil to ease the itch. How can we ease the itch?
Twofold. I mean, I usually for my patients, I tell them that they can apply a cream The cream is actually easier inserted by your doctor because it's quite deep inside. You can't do it. Uh, Otherwise, the outer ear you can still put the cream, or if it's really very bad, you can take antihistamines, uh, or a little bit of steroids is really very bad, but mostly antihistamines can do the job. Yeah.
Okay, next question is, what is the healing success rate of patching the hole on eardrum for NPC Survivor?
Good, it is good. Uh, Definitely every year condition is different. I would estimate the healing success rate to be about 85%. Um, you are no different from someone who has diabetes, who's poorly controlled. Basically, you're thinking, oh, am I an NPC survivor? And does it mean that my healing chance is poor? The answer is no. The other thing, of course, is to look at your ear structure. If you are osteoradionecrosis, I agree that your osteoradionecrosis, that means your ear canal is very jagged. Then I would say that the success rate is guarded. But if you have a normal canal, it's okay. Yeah, you're all right to do.
Okay, Dr. Luke, next question from me.
Mm,
I used to have vertigo problem, but over time it has died down. So I'm wondering this vertigo problem could it also link to the ear due to the radiotherapy treatment?
no. Okay. So one of the things which is not a NPC related issue is vertigo. Vertigo is not specific to NPC. All right. So it probably is a separate issue. The vertigo can be wow, can be a lot of reasons. Number one reason would be due to the what we call BPPV. That means a tiny little stone from your ear has swum the wrong way. It's supposed to go a proper drainage pathway, but it swum to the narrow pathway. So it got stuck there, and that's what gives you this giddiness. So that one's the easiest to treat because we will do some positional maneuvers, and hopefully the stone comes out. Sometimes some people need a few more treatments because it's just not one stone, it's two or three. So that's the number one cause of vertigo. Number two, it can be related to what we call imbalance of the balance canal nerve. So what we call vestibular neuronitis, it can happen after a bout of flu, quite common, very bad flu. Then one day you wake up, oh, you're spinning for the next 24, 48 hours. But after that, better already. So that's vestibular neuronitis. There are some unfortunate patients who have repeated attacks of, say, BPPV or vestibular neuronitis, so much so that their balance canal never got time to recover. And then over time, they didn't do any what we call physiotherapy for the balance canal, and it's chronically what we call uncompensated. That means it's very small little turns in their head will trigger a little bit of not spinning but a bit of gong gong feeling. So that one needs a little bit of active treatment to try to bring up the function of your balance canal. Those are called chronic vestibulopathies.
Okay, good, thanks. One more from me, Dr. Liu, is about
Yeah.
keeping balance.
Mm.
Sometimes I feel that I also cannot keep my balance as good as before.
Oh,
So
okay.
could this be also one of the side effect
Yes.
of the treatment?
It is possible. I would say that it would not give you big spins, but it will give you a bit of gong gong feeling. And
Yeah,
actually,
yeah.
correct. And actually, there are what we call home vestibular exercises, which one can try at home to try to improve your balance, which I teach to my patients. And maybe we can do it together actually. Can you all see me? You can all see me, right?
Yeah,
Okay.
can see.
Okay, so I will just demonstrate to you. So
Okay,
everyone can do it now, just
yeah,
at your chair. So your eyes look at your big thumb, all right? And then you go up and down and up. Eyes keep looking at your thumb,
yeah.
up, down, up. 10 repetitions. Okay? Then you do, yeah. Then you do left, right, left. So that's one rep. Then right, left. Two reps. Okay,
Okay,
so you do it up and down 10 times, left, right 10 times. You can do it once a day for a week or so, it will be good. Okay, so that's exercise number one. Exercise number two is this. Okay, everyone put two fingers in front of you. Okay, then your eyes would rotate, focusing on one finger, and then jump to the next in 3 seconds. So everyone look at your left finger now. 1, 2, 3, 4, 5. Then focus on the next finger on the right. Next, and hold it there. 1, 2, 3, 4, 5. Go back to the other one. 1, 2, 3, 4, 5. Go back to the other one. 1, 2, 3, 4, 5. So you do this, what we call exercise. If you can do it 10 reps, also it'll be good. So these are like home exercises which are easy to do while you're sitting down on the bus. Also, you can do, or in the MRT. So these are simple things you can do to try to strengthen your balance system.
Okay, good.
Yeah.
Okay, folks, anybody got any question? Now is 12:40 already. Because Dr. Liu got another show to rush. Okay.
Okay.
Any last question? Maybe one last question.
I think
Anybody?
we have one from Kun Sik. Do you mean mild hearing loss, is it? If
Okay,
mild
Kusek has a question. If you have encountered mild hearing loss, hearing loss, is there any ear exercise you can do to help or at least slow it?
don't have, I'm afraid not. Yeah, there isn't, unfortunately.
So as what Dr. Liu said, if you suspect anything wrong with your ear, quickly go and see a ENT specialist.
Yeah, or your
Okay, if you
own.
don't have anybody, go to Dr. Liu. I will give you her name card. She's really a very good doctor, very passionate and very friendly, and really very open. All right. So yeah. Okay,
All
I
right.
recommend a few members to go to see her, and they're all very happy with her service. Yeah.
Thanks, Dave, for the plug. All right. Just
So
to end off, thank you very much, everyone, for attending. And you can always reach out to me if you have any questions. But I am not the only source. Of course, you also have your own ENT doctors who you see regularly. And if you are comfortable with them, go ahead, by all means, ask them about your ears as well.
yeah. Okay. Thank you so much, Dr. Liu. Yeah. On
Yeah,
a beautiful Saturday, you managed to squeeze 1 hour or so of your time. We are so grateful, Dr. Liu.
you're welcome.
Okay. I'm sure you are. No, the feedback is they want you back soon. Thank you so much. Have a good weekend, Dr. Liu.
Happy weekend to everyone.
Yeah. We'll
Bye.
catch up soon. Yeah. Bye.
Bye.
Bye, everybody. People, before you go, you can give me feedback on how to make this webinar better through the regular chat. All right. And really, if you need Dr. Liu's name card, I can chat it to you. Or text me separately. Bye, everybody. Thanks for coming on board. Have a great weekend.
Okay,
Okay,
bye.
bye.